Thank you for watching. We're so excited you're here to learn how to stay healthy during pregnancy. For more helpful tips and weekly videos, please subscribe and hit the bell icon to stay updated. Today, we're diving into diabetes in pregnancy, causes, risks, and solutions. You'll discover what you need to know to keep you and your baby safe. Let's jump right in. Gestational diabetes, also called diabetes in pregnancy, happens when your body can't produce enough insulin to manage blood sugar levels. This usually occurs around 20 to 24 weeks of pregnancy. Hormones from the placenta, like human placental lactogen, make your body more resistant to insulin. This causes blood sugar to rise. Think of insulin as a key that unlocks sugar for energy, but during pregnancy, that key doesn't work as well. If not managed, gestational diabetes can lead to risks. These include a larger than average baby, known as macrosomia, premature birth, or preeclampsia. Preeclampsia is high blood pressure that can be serious for you and your baby. The good news? With early action, you can manage gestational diabetes. According to the American Diabetes Association, most women control it with diet, exercise, and sometimes medication. Today's video is all about diabetes in pregnancy, causes, risks, and solutions, so let's explore what you need to understand. Some signs of gestational diabetes might feel like normal pregnancy discomforts, but they shouldn't be ignored. You might feel thirstier than usual, even after drinking plenty of water. This happens because high blood sugar makes your body flush out sugar through urine. This dehydrates you, so you're reaching for water all day, maybe even at night. Another sign is frequent urination. High blood sugar makes your kidneys work harder, leading to more bathroom trips. Pregnancy already increases urination, but waking up multiple times at night to pee is a red flag. Fatigue is also common. If you're exhausted despite resting, it could be because your body isn't using sugar effectively for energy. Blurred vision might happen too. High blood sugar can affect the fluid in your eyes' lenses, making things look fuzzy. Lastly, genital itching or frequent infections like yeast infections can occur. High blood sugar creates an environment where bacteria thrive. Eating for gestational diabetes means choosing low glycemic foods to keep blood sugar stable. These include whole grains, vegetables, and lean proteins. Swap white bread for whole grain bread or sugary snacks for berries. A sample breakfast could be oatmeal with almonds and a sliced apple. This keeps you full and your blood sugar steady. Lunch could include a grilled chicken salad with quinoa and lots of colorful veggies like spinach and bell peppers. For snacks, try Greek yogurt with a handful of nuts or sliced cucumber with hummus. Avoid sugary drinks like soda or juice, as they can spike your blood sugar quickly. Instead, drink water or unsweetened herbal teas. Planning meals ahead can make this easier. For example, batch cook quinoa or roast veggies for the week. Pairing carbs with protein or healthy fats, like avocado with whole grain toast, slows sugar absorption. A dietitian can help customize a gestational diabetes diet that works for you and your baby. What causes gestational diabetes? Besides placental hormones, risk factors include being overweight before pregnancy, having a family history of diabetes, or being over 25 years old. Women of certain ethnic backgrounds like African, Hispanic, Asian, or Native American may have a higher risk. Polycystic ovary syndrome, POS, or a history of gestational diabetes in a previous pregnancy also increases your chances. Don't worry if some of these apply to you. Knowing your risk helps you take action early. For example, maintaining a healthy weight before pregnancy or staying active can lower your risk. Even if you're diagnosed, gestational diabetes often goes away after delivery, but it does increase your chance of type 2 diabetes later, so keep monitoring your health. Let's talk about the gestational diabetes test. Between 24 and 28 weeks, your doctor may recommend a glucose screening. You'll drink a sweet solution, think of it like sugary orange soda, and they'll check your blood sugar after an hour. If the results are high, you might need a follow-up test called the glucose tolerance test, which takes about 3 hours and involves fasting. Don't stress, this test is routine for many pregnant women. If diagnosed, your doctor will guide you on next steps, like monitoring blood sugar at home with a glucometer. You prick your finger a few times a day to check levels, usually after meals or first thing in the morning. It's quick and becomes second nature. Keeping a journal of your meals, activity, and symptoms can help you spot patterns and share useful info with your doctor. What are the risks if gestational diabetes isn't managed? For your baby, high blood sugar can lead to macrosomia, meaning a baby weighing over 9 pounds. This can make delivery harder and increase the chance of a C-section. Babies may also have low blood sugar right after birth, needing extra monitoring. For you, there's a higher risk of preeclampsia, which can cause swelling, headaches, or vision changes. Uncontrolled gestational diabetes also raises your chance of developing type 2 diabetes later in life. The bright side? You can lower these risks with simple changes. Regular check-ins with your healthcare team, a balanced gestational diabetes diet, and light exercise like walking can make a huge difference. Let's bring this to life with a story. Meet Sarah, a 32-year-old expecting her first baby. Around her 24th week, she noticed she was thirstier than usual and kept running to the bathroom at night. She felt tired all the time, even after sleeping. At first, she thought it was just pregnancy, but she mentioned it at her next checkup. Her doctor ordered a gestational diabetes test, and Sarah tested positive. She was nervous but worked with a dietitian to plan meals. She started eating oatmeal with berries for breakfast, grilled fish with veggies for dinner, and walked 20 minutes daily. She also checked her blood sugar regularly. By her due date, Sarah's blood sugar was stable, and she delivered a healthy 7.5-pound baby girl. Sarah's story shows that with the right steps, you can manage gestational diabetes and have a healthy pregnancy. How can you start managing or preventing gestational diabetes today? First, talk to your doctor if you notice symptoms like thirst, frequent urination, or fatigue. Don't wait. Early action is key. If you're not yet diagnosed, ask about the gestational diabetes test at your next visit. Meanwhile, focus on small, doable habits. Eat balanced meals every 3 to 4 hours to keep blood sugar steady. A plate with half veggies, a quarter lean protein, and a quarter whole grains is a great start. Try prenatal yoga or a daily walk. 20 minutes is enough to help your body use insulin better. Stay hydrated with water, aiming for 8 to 10 glasses a day, and avoid sugary drinks. If you're diagnosed, your doctor might suggest medication like insulin if diet and exercise aren't enough. Most importantly, don't feel overwhelmed. You're not alone, and your healthcare team is there to support you. Let's address some common worries. Many moms fear gestational diabetes means they've done something wrong, but that's not true. Your body is doing an incredible job growing a baby, and hormonal changes are natural. Others worry about their baby's health, but with proper care, most babies born to moms with gestational diabetes are healthy. Some ask if they'll have diabetes forever. For most, gestational diabetes goes away after delivery, though you'll want to keep an eye on your health to prevent type 2 diabetes later. If you're wondering about exercise safety, low-impact activities like walking or swimming are generally safe, but always check with your doctor. Knowledge is power, and understanding diabetes in pregnancy, causes, risks, and solutions helps you feel confident. Here are some practical tips to wrap up. Track your meals and symptoms in a simple notebook or app to share with your doctor. Test your blood sugar as recommended. It's a quick way to stay on top of things. Connect with other expecting moms for support, maybe through online groups or prenatal classes. If you're struggling with meal ideas, search for gestational diabetes diet recipes online for inspiration, like veggie-packed stir-fries or smoothies with spinach and protein powder. Keep stress low with deep breathing or meditation, as stress can affect blood sugar. Most of all, celebrate small wins. Every healthy choice you make is a step toward a safe pregnancy. To wrap up, today we covered diabetes in pregnancy, causes, risks, and solutions. You learned about symptoms like thirst and fatigue, risks like macrosomia and preeclampsia, and solutions like a gestational diabetes diet and exercise. We shared Sarah's story to show what's possible with early action. We're here to empower you with clear, reliable advice for a healthy pregnancy. Comment below. Have you noticed any symptoms or tried these tips? Let us know. Subscribe for more videos on gestational diabetes symptoms, diet, and tips. Check out our playlist on gestational diabetes management for more ideas. Follow us on Instagram for daily pregnancy health tips. Always consult your healthcare provider for personalized medical advice. Thanks for watching and see you in the next video.